Being told you have to change your behavior and actually doing it are two different things. And for the 26 million or so Americans dealing with diabetes and the 70 million or so with prediabetes, lifestyle changes are a must to have a healthy life. But change isn't easy, especially when you're doing it alone. However, a new program has been created to help diabetics empower themselves to change while getting one-on-one and group help. Debbie King with the Diabetes Management Program at Bedford Memorial Hospital tells us more. Take a look.
The Clinic Diabetes Management Program is based in Roanoke, Virginia. We do have some expansion sites, one already at Franklin Memorial Hospital in Rocky Mount, but we're getting ready to expand the program here to Bedford Memorial Hospital in Bedford, Virginia.
And there's so many people out there with diabetes, and there's a lot more possibly going to have it, isn't there?
That's correct. In the United States alone, there are estimated to be about 26 million people with diabetes. And there's a category called pre-diabetes, and there's probably 65 to 70 million people in this country with pre-diabetes, which means they're at a greater risk for developing diabetes if they don't do some modifications in lifestyle with improving exercise, healthy nutrition, and possibly losing weight to avoid developing diabetes in later life.
And I think we all know in life that it's really hard to change our habits. You know, this is what this program's really focused on, isn't it?
It is. The program's focused on meeting the individual, identifying where they are, what they're interested in changing, and then helping them to develop an individual plan to modify lifestyle like activity and nutrition.
And Marty, you're actually a big part of this program, and you'll be meeting with folks. Tell us what the whole, the program will be like, and how you get to know every person.
Well, our program is starts with an individualized assessment of each of our patients that come, and then from there we work with them in a group comprehensive education plan to help them set small goals to help them achieve success so that they can manage their diabetes, not have their diabetes manage them.
And that's a very good point, because there are some serious side effects if you don't manage your diabetes, isn't there?
Absolutely. And by taking a positive focus, teaching individuals how to deal with the stresses of life, how to fit in a healthy nutrition plan, how to cope with stress, how to have an individualized education plan that works for them, that will help them keep their A1C down and minimize the risk.
And you said A1C. Tell us, for folks out there that don't understand what that is, what it is.
An A1C is a 3-month average blood sugar that is taken to assess how well diabetes is controlled.
And somebody taking their own blood glucose levels, this is beyond that, isn't it? I mean, that's what you guys are here for, to help manage that, aren't you?
Absolutely. A fasting blood glucose will give you a snapshot in time, but an A1C will give you a 3-month average. And by working with the skill sets, healthy diet, individualized exercise program, healthy coping skills, that will help the individual minimize and keep their blood sugars in control over the long run.
And this is really important because, I mean, we're talking possible death, we're talking comas, right? We're talking amputations. I mean, you really need to pay attention to this, isn't it?
Absolutely. And we teach individuals how to focus on the skills that will help them maximize success.
And I assume one of those is really teaching folks how to manage their time, because food and exercise and getting those things into your day is not an easy thing to do.
Absolutely. We help them break down strategies so that they can implement and be successful instead of trying to change everything everything at once, which can lead to disaster.
Yeah, good point. One thing I find so exciting about this program is just the excitement in you. You seem very enthusiastic about this.
To be the Bedford-based diabetes educator with the Carilion program has really been one of my long-term goals, and I am passionate about helping people with diabetes prevent complications, but also to help those that are pre-diabetic to minimize their risk, because what we're looking at is quality of life in Bedford County.
And really, too, you know, you're offering this program, it's beyond the doctor's office. It's beyond the doctor saying, here's a leaflet, learn what you can about diabetes. You come, you can be with diabetics, you learn from each other, you survive this together.
Absolutely. What we're doing is we're forming a partnership with the primary care physician and our diabetes educator experts to help with those strategies. So we're going to work alongside the physician to make sure that those patients have the skill sets to be successful.
And if you'd like to learn more information about this diabetes management program, you can call them 540-224-4360 or go to CarillionClinic.org.